Hello everyone, welcome to Tech Sharmit. In this session, we will discuss about few more medical terminology related prefixes that denotes the information related to body part. Okay, so if you are following the entire series, then you know that previously also we have discussed various type of categories for the medical terminology prefixes, where we saw some prefixes that denote the shape, size, color, and other properties as well, right? And now we are going to discuss about the information related to body part. So this session is in the continuation of the same, and we are in the part 32. Okay, so let's see what we have today. Before we start, let me tell you, like just for those who are directly referring the session, let me repeat the definition for the prefix. So prefix is a word which is attached at the beginning of the medical terminology, and from there it generates some meaning. It produces some meaning and denotes some information, right? Then this thing we will denote with the help of medical prefix. Okay, fine. So now we are good to start with the session. So how we are going to proceed with this session? First of all, I'll tell you about few prefixes, and once you are comfortable with the prefixes and its meaning, then we will see and we will walk through some examples, because examples are the only thing that will help you to identify the medical terminology in your exam or in the interview processes. Okay, so that's why we will also walk through some of the examples for each and every prefixes that we are going to discuss now. Okay, alright, so now we are good to start the session. So let's see the first prefix we have. The first prefix is my or myo. My or myo, which is mainly used in order to discuss regarding the muscle. Now, there might be some question from the viewers, like we have already discussed the prefix related to muscle. Yes, you are right, but as I told you earlier also, that there are various alternative for one particular thing. Okay, for muscles there are different types of alternative prefix as well. So we should know about each and every prefix which we can use for to denote the muscle. Okay. Now, if we look at the example, my or myo is mainly used to denote muscle. Now, if you look at the example, which is myalgia. Now, what is myalgia? It's a pain or tenderness in the muscle. Myalgia means pain or tenderness in the muscle. Likewise, if you look at the second example, which is myasthenia. Myasthenia means muscle weakness, often used in the context of autoimmune disorder. So the patient who is suffering from the autoimmune disorders feel the weakness in the muscle. So that to denote that particular condition or that situation, we will use the medical terminology myasthenia. Myasthenia is a complete terminology where my is a prefix which is denoting the muscle. Okay. Likewise, if you look at the third example, which is myectomy. Now, what is myectomy? Myectomy means surgical removal of a portion of a muscle. Okay, so maybe for some of the medical purposes, if a portion of a muscle is removed surgically, then this thing we will denote with the help of myectomy. Now, like we have already discussed various prefixes so far. That's why we are able to identify like whether whenever there is a suffix, not the prefix, suffix used as ectomy, that means somewhere we are talking about the about the surgical removal. So this is the advantage of learning about the examples, because by repetition of examples we got some idea that yes, whenever we are talking, although we have not learned about anything suffix related so far, but still we know that whenever there is a word related to ectomy, that means something is surgically removed. And the prefix, if the prefix is by, then uh, it we are removed the we have removed the uh, portion of a muscle or something related to muscle. Okay, so this is the third example for this prefix. Third example, then we have myitis. Myitis means inflammation of the muscle tissue. Inflammation of the muscle tissue. So if due to any of the reason, if the muscle tissue are inflamed, then in that case we will denote the thing with the help of terminology myitis, which is started with the prefix my. So if you look at all the examples again, you will find only one common thing in between them, which is muscle. Everywhere we are talking about the muscles. Okay. Now we will look at the second prefix, which is myel or myelo. Myel or myelo, which is related to spinal cord or bone marrow. Okay. So if there is a discussion around spinal cord or bone marrow, then we will use the terminology prefix as myel or myelo. So let's look at the examples of it. First one is myelitis. Myelitis means inflammation of the spinal cord. Just because of any medical concern, if the inflammation occur in the spinal cord, then in that case we will use the terminology myelitis. Myelitis. Similarly, if you look at the second example, which is myelography. Myelography means radiographic examination of the spinal cord after injection of contrast medium. So if you are examining the spinal cord after injecting some type of contrast medium, then this thing we will denote with the help of terminology myelography, which is again started with the prefix myelo, and it is related to spinal cord. Okay. Likewise, if we look at the third example, which is myeloma. Myeloma means a tumor of the bone marrow. If a tumor is produced in the bone marrow, then this thing we will denote with the help of prefix with the help of terminology myeloma. Okay. Now if you look at the fourth example, which is myelopathy. Myelopathy means any disorder or disease of the spinal cord. So if there is anything wrong with the spinal cord, if a patient is suffering from any disorder disease of related to spinal cord, then this thing we will denote with the help of myelopathy. Okay. So yeah, now if you look at all the examples again, you will find only a few things which is common, uh, which is spinal cord or bone marrow. In every example, we are talking about either spinal cord or bone marrow, and that's the reason why we are using the prefix myel or myelo. Okay, so far we have discussed two prefixes. First one is myo or myelo, related to muscle. Sorry, my or myo related to muscle. Then we discussed about myel or myelo related to spinal cord or bone marrow. And then we have another third prefix, which is nephro. Nephro means nepher or nephro means kidney. So if there is a discussion related to kidney, then we will use the prefix nepher or nephro. For example, nephritis. What is nephritis? Inflammation of the kidney. If there is an inflammation of kidney, then this thing we will denote with the help of nephritis. Now if you look at the second example, which is nephrologist. Now who is nephrologist? Nephrologist is a medical specialist who deals with the disease and condition of the kidney. Okay, so that specialist we will denote with the term nephrologist, which is again started with the prefix nephr, which means um, kidney. A person who is experienced or who is a specialist in dealing with the conditions related to kidneys. Then we have nephrectomy. Nephrectomy means surgical removal of a kidney. Just because of any medical reason, if the kidney is removed, then surgically, then that thing we will denote with the help of nephrectomy. Again, you can see suffix ectomy is used in order to relate it, in order to show surgical removal of something. Then we have nephrolithiasis. Nephrolithiasis means formation of the kidney stone. So if the stones are formatted or developed in the kidney, then this thing we will denote with the help of nephrolithiasis. Okay. So yeah, these are the all prefixes which I would like to share with you all in this session. I hope it is clear to all of you. And for today, there is one question for you guys, which is what information is provided by the prefix muscle or musculo and mest or mesto. Okay, I know if you know the answer of this question, then I request you to share your knowledge in the comment section so that others can take a reference from there itself. And if you have any difficulty in answering this question, or if you are not aware of this topic, then you can check out the previous session, because there we have already covered these two topics in detail. So from there you can take a reference and then you can answer this question. Okay. So yeah, that's all for today. I hope this session is clear to all of you. In the next session, we will discuss few more things. So thank you for watching Tech Sharmit.